Hi, good morning everyone. First of all, let me introduce ourselves. My name is Shiva and my partner is Rangga. Today, we will explain our presentation on the effects of smoking. So, before we get to the point of discussion, we need to know what the cause of this topic is. Maybe some of you are familiar with smoking, but what exactly is smoking? Smoking is the act of inhaling and exhaling the fumes of burning plant material. A variety of plant materials are smoked, including marijuana and hashish. But the act is most commonly associated with tobacco as smoke in a cigarette, cigar, or pipe. Tobacco contains nicotine. What is nicotine? Nicotine is an alkaloid that is addictive and can have both stimulating and tranquilizing psychoactive effects. The smoking of tobacco, long practiced by American Indians, and was introduced to Europe by Christopher Columbus and other explorers. Smoking soon spread to other areas and today is widely practiced around the world despite medical, social, and religious arguments against it. Okay, so furthermore, we will present the effects of smoking one by one. First is lung damage. The question is, why smoking can cause the lung damage? It's because a person inhales nicotine among other chemicals. Second, heart disease. The chemicals and tar in cigarettes can increase a person's risk of atherosclerosis, which is the build-up of plaque in the blood vessel. This build-up limits blood flow and can lead to dangerous blockage. Smoking also increases the risk of peripheral artery disease or PAD, which occurs when the arteries to the arms and legs start to narrow, restricting blood flow. Third, fertility problems. Smoking cigarettes can damage a female's reproductive system and make it more difficult to get pregnant. This may be because tobacco and other chemicals in cigarettes affect hormone levels. In males, the risk of erectile dysfunction increase the more they smoke and the length of time they smoke for. Smoking can also affect the quality of the sperm and therefore reduce fertility. Next, fourth, risk of pregnancy complications. For example, increasing the risk of ectopic pregnancy, reducing the baby's birth weight, increasing the risk of preterm delivery, damaging the fetus lungs, brain, and central nervous system, increasing the risk of sudden infant death syndrome or SEDS, contributing to congenital abnormalities such as cleft lip and cleft palate. Fifth, risk of type 2 diabetes. The CDC report that people who smoke regularly have a 30 until 40% higher risk of developing type 2 diabetes than those who do not. Smoking can also make it more difficult to people with diabetes to manage their condition. 6. Weaken immune system. Smoking cigarettes can weaken a person's immune system, making them more susceptible to illness. It can also cause additional inflammation in the body. 7 is poor oral hygiene. People who smoke have double the risk of gum disease. The risk increases with the number of cigarettes a person smokes. Symptoms of gum disease include swollen and tender gums, bleeding when brushing, loose teeth, and sensitive teeth. Smoking tobacco can limit a person's ability to taste and smell things properly. It can also stain the teeth yellow or brown. 8. Integumentary system. Smoking tobacco can affect a person's skin and hair. A person who smokes may experience prematurely aged, wrinkled skin. According to the American Osteopathic College of Dermatology, some of the long-term effects of smoking include BGAs, deeper facial wings, dry skin, furrows, saggy jawline, and uneven skin pigmentation. And 9. Vision problems. Smoking cigarettes can cause eye problems, including a greater risk of cataracts and macular degeneration. Other vision problems related to smoking include dry eyes, glaucoma, and diabetic retinopathy. People who smoke also have a higher risk of skin cancer, particularly on the lips. Smoking can cause the hair and skin to smell like tobacco. It can contribute to hair loss and balding. It can also cause discoloration of the nails, causing them to become yellower or brown.
Risks of other cancer. In addition to the well-documented link with lung cancer, smoking threatens contribution to other cancer. The American Cancer Society report that cigarette smoking causes 20 until 30% of it penetrates cancer. People who smoke are also 3 times as likely to develop bladder cancer than people who do not. Smoking cigarettes can also double a person's risk of stomach cancer. Research linked tobacco to cancer in the upper part of the stomach near the esophagus. This is known as esophageal cancer. Digestive system. Cigarette smoking is a major risk factor for a person developing intestinal disorders. Smokers are more likely to develop gastritis, inflammation in the stomach lining than non-smokers, which can lead to ulcer in the stomach or intestine. Smoke may also cause delayed emptying of the stomach and slow peristalsis. Central nervous system. All smokers' central nervous system becomes damaged because nicotine causes increase in blood pressure and heart rate. Because these organs do weaken over time. According to a study, smoking tobacco and nicotine seriously impacts neurological health. The study reported that smoking a risk factor for Alzheimer's disease and multiple sclerosis. Secondhand smoke. Secondhand smoke can also significantly affect family members, friends, children, and workers. Secondhand smoke causes lung cancer, according to the American Cancer Society. Advance has also linked secondhand smoke to other cancer, including throat and breast cancer. Children whose parents smoke get sick more often, have more lung infection, and are more likely to have shortness of breath. If a fetus or baby is exposed to secondhand smoke, they might be at risk of childhood cancer such as leukemia, brain tumor, lymphoma.
Next, here are some solutions for people who want to quit smoking. First, list your reasons to quit. Second, tell people you're quitting. Third, if you have tried to quit before, remember what worked. Fourth, use stop smoking aids. Fifth, have a plan if you are tempted to smoke. Six, list your smoking triggers and how to avoid them. 7. Keep cravings at bay by keeping busy. And 8. Exercise away the urge. Okay guys, that's all from our presentation. We really hope that we can open your eyes to the dangers of smoking and to avoid touching cigarettes. We really apologize for the lack of this presentation and thank you so much for your attention. Goodbye.